All right, a very good afternoon or evening, depending on where you are, and welcome to this information session on the ESOT Hackathon 2021. My name is Tom Braakleers, and I will be moderating the session. And just to give you a little bit of a heads up on what to expect during the hackathon process in the months to come, because it's going to kickstart right now, but will take a few months to complete the entire process. So like I said, I'm Tom Braakleers, and I will host you through the afternoon or evening session as you want. There we go. There we have the slides. If they want to move, that would be nice. No, they don't. Okay, let's do it that way. So this is the agenda. We'll first start with a first introduction, then why a hackathon exactly? What are some of the challenges? You may have seen already some videos passing by on social media, but we have also a few speakers for you to talk about some of the challenges we'll be tackling during the hackathon. And then for those completely new with the hackathon process, don't worry, we'll explain you what a hackathon is exactly, what's at stake, how do you collaborate, how do you register, all these kind of practical things will all be clear. And of course, how the jury process is going, how the evaluation is going, and what the prizes are that you can win. So all of this will be covered in the next hour or so. If there's during the session some questions you have, do not hesitate to use the Q&A window. We'll keep the questions until the end, but you can already put them in the Q&A window. And then depending on how many questions we have and how many we have in the audience, maybe you can raise your hand if you have a question and you can unmute yourself so you can ask it live. So that is about the hackathon itself. And my clicker is really not working with me today. Good. So I'll briefly introduce me as I'm responsible for the Blue Health Innovation Center, and we were actually asked by ESOT to help organize this hackathon. We're a not-for-profit, and we're focused on digital transformation in healthcare, basically covering all areas, all things digital, but with a very specific focus on the creation of new and young entrepreneurs.
Tom, you are muted.
Yeah, okay, I should be back.
Yes, you are.
Somebody muted me. Not sure what. Maybe we should. All right, there we go again. Good. So we are recording this because some people couldn't make it. But I was talking about Blue Health and how we, as an organization, we try to make young entrepreneurship originate. And that means that we work a lot with new ideas, innovation, ideation, hackathons, these kind of things. So when ESOT approached us, we very gladly participated in this initiative. But enough about us. It's time to go to the first speaker of the day, and that's the president-elect for ESOT, Luciano Potena, who is with us today. And Ariane, you will share the slides for Luciano. There we go. And I gladly pass the microphone over to Luciano.
Thank you very much. Thank you all for attending. And I wish to start my brief introduction by thanking Luca, who is Luca Segantini, who's the head of the ESOT office, and all Ariane and all the rest of the ESOT office for the great job that I've been doing in supporting this initiative. So we can go to the next slide, please. Just very briefly, who we are for those of you who don't know who ESOT, what ESOT is. ESOT stands for the European Society of Organ Transplantation and is a scientific society that has been founded 30 years ago to improve science and education in the field of organ transplantation. We have a clear mission to improve the outcomes of patients with end organ disease by means of transplantation, but also by means of looking at innovation and innovative strategies to develop organ function through organ regeneration and organ substitution. How are we going to pursue this mission? by promoting scientific advancement, by gathering the multidisciplinary community. Transplantation and transplant healthcare professionals are a multidisciplinary group involved in surgery, medicine, internal medicine, rehabilitation, psychologists, nurses. So we have anesthesiologists, a huge amount of different professionals that are involved in the field and also in the different organs that are the target of transplantation. We deliver education to healthcare professionals involved in the fields at all levels of training and career development and career advancement. And last but not least, we aim to develop policies fostering advocacy and improving the public and institutional awareness for organ donation, research and equitable access to transplantation, and other therapeutic strategies that can be assimilable to transplant. The next one, please. In this slide, just to show you how the society is built and what is the peculiar structure of this society. So we have the ESOT main governance, which is the member general assembly that has to confirm and to elect the representative of the ESOT membership, that is the governing board, that is made by the executive committee, a council, and also the ESOT team, who is not elected, but is the people that are making all this possible, that are working every day for the society functioning. And then we have the sections and committees with a wide group of the specialties and the multidisciplinary specialties that are involved in transplantation and in society. So we have, you can see here, a lot of them that are involved in the different organs like kidney transplantation, thoracic transplantation, liver and pancreas transplantation. But not only, we have also the vascular composite tissues. We have the representative for the allied medical professional. We have the basic science. We have the young professional in transplantation. So all these sections are the core basis of the functioning of the society, and gives you the idea on the multidisciplinary and the rich environment through which the society is built upon. We have a reach out of 3,000 to 4,000 people that are the usual delegate and the community of the society. That is mainly directed to Europe, but it's also have an international reach out. So my last slide, please, the next one. And I just want to you to leave my initial address to this meeting by telling you about the core. At the moment is the core activity for the education and the biggest activity for education of our society, which is the biannual congress. And this year is going to be in Milan between the 29th of August to September 1st, and it's going to be the first big event with in-person and also online. And we are aiming in gathering again our community after this year and a half of pandemic. So this is who we are, and I hope that you will like working with us.
Thank you very much, Luciano, for that introduction and for taking the time to be with us today in your extremely busy schedule. Good. Moving to the next speaker, and that's basically the driving force behind this idea of should we organize a hackathon, and that is the CEO of ESOT. So I would like to ask Luca Segantini to take over the microphone and walk us through why you started this hackathon initiative and all the ins and outs of your end. Luca, over to you.
Thank you, Tom, for the introduction, and thank you for being here today. As the slide says, I'm the CEO of ESOT, but of course, we have a great team, a great group of volunteer leaders, and a great group of supporters. And you see the three supporters of the hackathon here. There'll be a few more as the process unfolds. As you know, it takes a village to accomplish anything. So the more partners, the happier we'll be. And my role today is to explain how an hackathon became actually a medical society project. For the ones in the attendance that are familiar with the hackathon concept, you will know that this is typically something used in very different industries. For example, the software industry, when they have a coding problem to solve, they gather for 3 days in a big hangar with a lot of pizza and strong coffee, and they work together day and night. And at the end, one solution or a few solutions are found. And you know, when I joined ESOT, I found an extremely innovative and open medical society. This is not your typical not-for-profit organization. So I thought they're already doing an awful lot of very innovative things, you know, but there is one problem that is still unsolved, or that could be helped by something different. And this is how to help transplant patients. Transplant patients, as my colleagues will explain in a moment, have a very challenging experience, right? It's a very serious thing, not only technically, but also psychologically, adjusting your life and a variety of other things. And all the support they can get, it's very beneficial to them. So we live in an era where there's a lot of tools, online, offline, apps via smartphones that could help these people. And some of them are already used in some centers in Europe and beyond. Or some of them are at the prototype level. Or some people have great ideas, but they miss the partnerships, the encouragement, the context in which to develop these ideas. And ESOT, with its huge network, could actually help these people to come forward, to propose their ideas, to have an experienced jury to look at them and help them develop it a little bit more, and eventually accompany them in the process of bringing it to the patients. So that's the ESOT Hackathon, really. It's the idea of not only scouting for good ideas, good prototypes, good apps and software and websites already existing out there, but also coach the people behind them, help them understand how this can reach more patients in Europe and beyond, and also help them potentially develop this as a product. I don't want to say sell it, but you know, it could become a commercial project. And this with the help of all our partners you see on this slide and other people who will be part of the jury will hopefully become a reality. That's all I have to say. I hope it's clear enough. There will be questions at the end, and hopefully the next presentations about the process and the jury and the prizes will help adding more pieces to the puzzle. And thank you for now.
Thank you, Luca, and thank you also for spending time with us today. Good. We're going to dive straight into the challenges because, as Luca said, this is not your typical hackathon where we put you in a very dark room with way too much pizza and soft drinks. We really want to tackle things that are top of mind with patients, with professionals, with doctors, what have you. So in order to do that, we brought three let's put it, experts forward that are spokesperson for their specific group. From the patient perspective, from the healthcare professional perspective, from the medical perspective, and just to give all these insights. And to start off that series, I would gladly like to pass the floor to Pisana Ferrari, who is here with us today, who is actually a patient that had a double lung transplant in 2002, if I remember correctly, and that has been a patient advocate for transplant patients ever since then. So I gladly pass the floor over to you, Pisana.
Thank you, Tom, for the introduction. Yes, it's been 19 years since my double lung transplant at the General Hospital in Vienna. And I'm here today to tell you how you can make a difference in transplant patient lives by joining the ESOT Hackathon. And I've identified 5 key areas in which you can help. My first point is about information. Everything is new for us, and we need to better understand how our body will react to the new organ and to the new drugs. And this means understanding, for example, what signs or symptoms to look out for, what to worry about or not worry about, what to report to our doctors, what the side effects of drugs are, and how to best manage a complex drug regimen. I think I have about 13 pills every day. So that's one very important point. My second point is about lifestyle. We need to take extra care of our bodies, and it's really important to establish healthy routines. So what is the best food to eat, what to avoid, if there are possible interactions between some foods and drugs, what is the best kind of exercise to do, how can I monitor my progress, how can I keep my motivation up? These are all important issues. And one of the risks with transplant is if you're doing very well, you tend to forget that you've had a transplant, and this can mean that you can skip your drugs or be a bit careless. And on the other hand, if you're not doing that well, you can get depressed and deconditioned. So I think lifestyle is a very important aspect. My third point is about coping with living in a state of permanent uncertainty, fear of rejection and other complications. Transplant is not the end of a patient journey. It's the start of a new one with many potential risks and uncertainties. And this can take a very big psychological toll, as Luca was saying before as well. My fourth point is about how to connect with other patients, finding ways to connect with other patients. Transplant is a really life-changing experience with many everyday challenges. So connecting with other patients who have been through the same experience is really very important. And my last point is about our transplant team. Now, normally we would see our doctors about once or twice a year. And during the rest of the year, we need to know that they are there for us, that we can interact even if at a distance. And we need to find ways in which this is possible. So to conclude, I think there's one more point there. Technology can help address many of transplant patients' unmet needs and challenges. So thank you in advance for joining the ESOT Hackathon. And thank you to ESOT for involving us and for launching this fantastic project.
Thank you, Pisana. And if you have questions, because each and everything that Pisana said could be an individual challenge to be solved, there's many angles that you can take, but that will all be clear also when we kickstart the actual process in 2 weeks' time. That will all be clear. How do you go from these broad challenges to a specific solution? So thank you for sharing your insights and for your perspective. Very valuable insights there. Now, the other angle that we would like to take is that from a healthcare professional. So for that, we have invited Anna. Anna is from Sweden. She started her career as a nurse, but in the meantime has grown into the chairwoman of the European Transplant Allied Healthcare Professionals. It's a mouthful, but I'm sure she's used to saying that. So Anna, welcome, and the floor is yours.
Thank you. Nice to meet you. And thank you for this opportunity to be a part of this hackathon event. At the moment, I'm sitting at the hospital, actually. I'm a nurse, as mentioned in the introduction, but I'm also a professor in transplant nursing in the south of Sweden. And I actually came directly from one of our lung recipients to this meeting. So first, I would like to say that this hackathon is a great initiative. I've been working with transplant recipients for 26 years, so I have a fairly long experience. And one thing that I constantly try to emphasize is that a transplant recipient is a person with an organ, and we should pay attention to the person with an organ and not the organ in the person. Being a person with a new organ means, like Pisana mentioned, a great challenge to adapt to many new things in everyday life. And one of my main concerns as a nurse, a transplant nurse, but also a experienced transplant researcher, is that there is a huge challenge regarding how to transfer knowledge from the healthcare professionals to the patients in an easy and accessible way. There are extensive demands of self-management, and unfortunately, there are quite little support given from the healthcare professionals because, as Pisana mentioned, they see us not that often, and they spend a lot of time on their own with their families in their everyday life, striving to go back to work, and the support that is needed is rarely provided. So what I hope for with the hackathon event and the hackathon challenge is that we will see technical solutions that provide easy, accessible support directly to the organ recipients. A second concern that I have is that, and it's about equal transplantation care, because as a transplant recipient today, you are quite dependent on the knowledge level of the individual healthcare professional. And I think that's a concern because it depends on who you meet on your follow-up. Instead, I would like to see that the knowledge, the things we know today from research or from a clinical experience, that knowledge should be nicely packaged and in a supportive way be transferred to the patients without any barriers and with in a format that is easily accessible and nice to grasp, you know. So with pictures, with text, with motion, things that can give you energy in your everyday life. And the final thing that I want to mention is also to refer to what Pisana said before, that being a person with a new organ also means dealing with quite a lot of uncertainty. Am I doing enough? How long will it last? How can I deal with the side effects of the medication and so on? And I would really like to see new technical solutions that sort of relieve the issues of uncertainty and provide the information needed to actually be more certain and more self-confident and have enough self-efficacy in your everyday life, because we know that that really brings health-related quality of life to the organ recipient. So I really have high expectations on you all who will do this, and I'm really looking forward to the proposals you will make. And yeah, I really hope that you will come up with something nice for us to assess in the future. So thank you.
Thank you very much, Anna, for sharing your perspective, and already some things that starts to being repeated from both healthcare professional and from patient perspective, things like knowledge transfer, information, the uncertainty aspect that of course is always there. And so the goal of the hackathon is to really find potential solutions for these challenges. You probably won't be able to fix them all, and don't worry about that. It's not about fixing everything, because if you want to fix everything or boil the ocean, as it's often referred to, then chances are that you will get not far enough or even nowhere. So it's really about starting from one specific use case and then move forward. So thank you, Anna, for your insights as well from that perspective. The third perspective is that from the medical angle. And the goal was to have Dr. Giuseppe Feltrin with us today. Unfortunately, he couldn't join us, so we have a pre-recorded video. But Dr. Feltrin is coordinator for the European Donation and Transplant Coordination Organization. He's been a cardiac surgeon professionally and has been involved with coordinating transplant centers for the vast majority of his career. So I suggest we have a look at the video that was pre-recorded, and let's have a look.
Hi, I'm Giuseppe Feltrin and I challenge you. I started my career as a cardiac surgeon and now I am the regional transplant coordinator of Veneto region. When I was the responsible for the cardiac transplant recipients of clinic, I followed many patients in their transplantation journey. I'm convinced that recipients' compliance to medical recommendation is crucial in achieving good long-term outcomes and quality of life. Some of these recommendations may be hard to be understood, and some of them may even appear conflicting, if not explained. I believe that the gold recipe for a good patient-to-doctor interaction is based on mutual trust. This can only come from an open discussion with our patients. Although nothing will replace the value of this direct interpersonal interaction, I think there is a wide room for technology to provide a greater amount of information to our patients about their status. My challenge is to all of you to contribute in supporting our transplant community to offer a better service to our patients and their families. I would like to think that technology can help to support patients, helping them with medication, warning them of side effects, and encouraging them to consult doctors when needed. If you think you have a bunch of good ideas, you are welcome to take part in the ESOT Hackathon. Thank you all and see you soon.
There I am. That was a video from Giuseppe. And so what he explained and what his challenge that he put forward mainly is, how do we take all this complex medical information and bring it to the patient and to the family of the patient and the next of kin and the care circle around that patient, that at least they fully understand what is expected, because like he said, some of the things are difficult to be understood, but also difficult to accept. So sometimes you may understand things, but still not accept them. So it's about how can technology play a role in that specific angle. So you've heard now three insights on what challenges are around surrounding the transplant community, from the patient, from a healthcare professional, from a medical perspective. And there are some similarities, but for this hackathon, we want to keep a very open perspective on all the different potential challenges that might arise. Some that were mentioned here is about information sharing, information transfer from the professional to the patient and the other way around, about lifestyle, handling uncertainty, getting in touch with other patients, getting in touch with staff from the professional environment. It was also about knowledge transfer, self-management, equal transplantation care and knowledge transfer in the sense of education, managing uncertainty. So many different angles, and you see on the slide a few more that you can take. Now, the goal of this hackathon is to start with this extremely wide range of potential challenges and hone in on a few of these. Now, we'll help you through a process that will kickstart in a week and a half to help you through that step by step. How do you go from these big problems, and they're called and referred to as fuzzy problems. And why are they fuzzy? Because it's not clear cut, like you have to do this. You could solve it doing many different things. And during this hackathon, we'll help you get from these fuzzy, undefined problems into a concrete potential solution. Now, you won't figure this out on a day. That would be extremely well done if you solve many of these challenges in a day, but at least you will kickstart the process. Now, to help you understand a bit more on how this healthcare hackathon process actually runs, Kim is with us as well, and she's our project manager on this specific hackathon and also one of our regional managers and startup coaches. So Kim, walk us through the process of a hackathon.
Okay, thank you, Tom. So I'm really here to talk to you about two things. One of them is, what is this hackathon process and why is it taking several months? So I've drawn, Tom, you can show the next slide. Yes, thank you. So we're starting bottom left with the info session, which is today. And as you know, in 1.5 weeks, we will kick off. So on the 2nd of July, we will spend a full day taking a sprint from the challenges we have today to ideating, so coming up with ideas of how you could solve one or maybe two of these challenges if they're closely related, to seeing for who you could develop this solution, what the actual benefits would be or which pains you would be taking away, and then in the last phase, think about maybe not necessarily a business model, but how could this be a viable solution? And then finally pitch it for our jury, which Ariane will introduce you to in a bit. This pitch is meant as a feedback session. So after this one day of 2nd of July, you will receive high-level feedback on the status of your ideas and hints on how to take it further. The jury will then select a maximum of 10 teams to continue to the rest of the program. The rest of the program starts with a number of workshops. We've foreseen a workshop on design thinking, one on business modeling, and one that's already in September on pitching. Throughout the summer, we will guide you with coaching. So if your team is working over the summer on validating ideas, checking who would be interested, maybe developing a pilot or a proof of concept, then we do regular checks with you to see how you're proceeding and what else you can do to make the result better. And then on 9th of October, there's a final pitch, and there we will make, or the jury will make, a selection of 3 teams who will be the winners of the hackathon. How do you go about registering for this? So how to participate? Every individual needs a ticket to participate. And the first entry point, or the only entry point, is participating in the kickoff of the 2nd of July through the Eventbrite link that I put in the slide here, or you can already take your phone and scan the QR codes. We have 2 types of registering, but I would say, to keep things simple, register for a single ticket and then send me an email. Because if you already have a team, or you are 2 people who collaborate intensely, but you're looking for a patient perspective or a nursing perspective or a doctor perspective, let me know who is in your team and who you still need to make your team complete. If you really are an individual looking to collaborate with other people, let me know that you want to join another team and we will make the puzzle. And if you have questions about that, please put it in the chat window. I'm always ready to support you in this process. So just send me an email. Voila, Tom.
Thank you, Kim. Short and concise as always. The thing about the team formation is maybe an important one for those that are thinking about creating their own team, is how do you combine people in the team? There's actually 3 profiles you're looking for. One is the hacker, the second one is the hipster, and the third one is the hustler. Those are typically the 3 profiles you're looking for. Now, in this specific hackathon, the hacker is typically the person with the expertise. So do not forget the patient perspective. If, for instance, you come from a healthcare professional angle and you want to solve some of the challenges, make sure to involve somebody with expertise on a certain topic, and that could be, for instance, a patient. So first off, you have the hackers. Those are typically people with an in-depth expertise in one specific area. The hustler is typically the person looking at how can we make this viable. So Kim mentioned business modeling as amongst others. That is definitely something to look at. Not to create startups per se, It could be an outcome of this, that you create a company with a project that moves forward, or at least it's about how can you make this into something that is sustainable, that is self-sustainable, or at least you have a thought about how can you make this project live forward. That's typically the role of a hustler, and then the hipster is the one that makes it nice and draws everything together, and that creates sort of a visual identity for the project, because the individual is in the jury that Ariane will explain later on. They're all human beings and they like to see things as well. And of course they look at contents, but format is also important, seeing the concise time you have to bring forward to that pitch. So those are typically the three types of persons. So look for people with expertise, look for somebody who can make it work in the sense of make it live on beyond the project. And thirdly, look for somebody who can help you tie everything together in something that sounds and looks nice. Those are typically the profiles you're looking for. Good. That was just an addendum on what Kim says. Now, for the last part, I want to introduce you to Ariane, who will walk you through what exactly the jury is going to look for in the selection of the first part, going from all the projects to the 10 projects that go forward over summer, and then also the prizes, of course. So Ariane, I gladly pass the microphone to you.
Thank you, Tom. So indeed, I will present to you today the jury, the evaluation criteria for the hackathon, and also, last but not least, the prizes. So first of all, the jury. So we selected a panel of people that obviously have a great interest in how innovation can help people with transplant throughout their journey. But we also selected people from very different backgrounds, as they will be looking from different angles, as we already saw today. So first we have Luca Segantini, who's Italian, the CEO of ESOT. He's actually almost Belgian because he's supporting the Red Devils, but that's between brackets. He's been working as an executive director for ESOT since 2019. And he has a very informal approach towards managing teams and managing volunteers. And he's very interested, as you could hear, in how innovation can bring, how innovative projects can really change nonprofits. Then we also have Claudio Procaccianti, who's Italian. He's actually representing one of our main supporters that believed in this rather unusual project for a medical society. So we really want to thank them very much. He's a global medical affairs manager for transplantation and cystic fibrosis for Chiesi Pharmaceuticals, but he also represents patient advocacy in his company. So that's why he has a place in our jury. Then we also have our current president. You already met Luciano, our president-elect. But as we're actually in between presidencies within this project, we have also invited Vasilios Papalois. He's a Greek nationality, Greek and British nationality actually. And he's working in London in the Hammersmith Hospital. He's a professor in transplantation and a surgeon and transplant consultant. And then we have in the next slide, people that I don't need to present to you. Anna Forsberg, that you've heard, our chair of our European Transplant Allied Healthcare Professional Group at ESOT. She's from Sweden and worked in Gothenburg and Lund. Pisana Ferrari, Italian, and she's a very strong advocate for patient groups, not only at ESOT, but in many other organizations. She has a background in political science and international law, and she has worked in EU affairs, PR, communications, and event management. And then we have Giuseppe that you heard as well through our video. Giuseppe is Italian. He's working in Padova, and he has followed a lot of pediatric and adult patients who had transplantation. And he's now a regional transplant coordinator for the Veneto region, sorry. So this is the jury. I also want to present to you today the judging criteria. So as you know, we have two deadlines. We have one first round or first pitch on the 2nd of July, where we will select the projects that will go on to the next phase. And then the final pitch will happen on the 9th of October. And we will be using a number of criteria to judge your projects. First and foremost, and you've already heard extensively about it, it's the societal impact of your projects and the potential for your project to improve the quality of life of the transplant patients. Then we will obviously also look for the innovation and creativity of your solution. So how novel is your solution or your project? Are there other similar solutions already on the market? And how creative were you addressing the challenges that we just heard about? Then we will certainly also look on the 2nd of July, we will look at the team effort and the team pitch. So did you pitch as a team? Has everyone been involved in the project, and who contributes in what way? And also, does your team have complementary skills? So that's a very important criteria as well. And then for the next phase, the two other criteria that will become also quite important will be the execution strategy. So is your team capable of executing the actual project, and what would be the steps to actually do that? And then also, as we're a European society, the scalability in the EU. So how is your solution available, or how could it be available in various European regions and even beyond? And something I also forgot, which is quite important, is that the viability of your project and the economic potential. So how likely is the solution run break even, or is it going to make a profit? And does the business model also include other aspects than potential subsidies that you get at the start or capital injections that you would get? So the business model will be also very important to look at. So these are the evaluation criteria. Then lastly, we want to also look at the prices, what's in it for you. And as we have two rounds, there are actually two types of benefits, because we do know, and the major aim of our project is really that it becomes a stepping stone for you, that you can continue your project or your business after this whole innovation program. So for the first round, if you're selected into the first round, you will be coached through a series of workshops. So we've already set some dates. On the 6th of July from 6 to 8 p.m. we will have our first design thinking workshop. Then we will have a business modeling workshop for you on the 12th of July from 6 to 8 p.m. as well. So we decided to have some evening sessions so that you can, if you have a day job, you can attend them. And then you will be guided to, during the summer season, so during July, August, and September as well, with a coach. So your team will be assigned a coach and you will have regular catch-ups with the coach so that you can see where you stand and what needs improvement in your whole process. And then finally, we will have a pitching workshop just before the final pitch on the 28th of September, so that you will learn how to pitch your project the best way to the jury. So that's for the first phase. And then if you are selected amongst the three last projects, you will also get a small monetary prize. We know that this is not the main reason why you're participating, because there's really a societal project behind the hackathon, and we're non-for-profit, but we also have a small monetary prize. So the first prize will be 1,500 euro, the second prize 1,000 euro, and the third prize 500 euro. And again, we really emphasize the fact that we really hope that this is the start of a new adventure, a new project for you. And what I also wanted to mention is that we do plan to have an award ceremony, an official award ceremony around the 15th of October in Athens, because that's where we will have our main council meeting. We're planning to have an in-person council meeting in Athens with all the leaders of ESOT and with some industry representatives as well. And if the situation allows us, we will invite you to be present at the award ceremony, and it will be a great networking opportunity for you to get in touch with our leaders at ESOT and with some industry representatives as well. But again, we don't know where we will stand in October this year, but we really cross fingers and toes that this will happen. So this is my presentation. And I think we're coming at the end of our session now, and it's the time for you to ask us questions.
Thank you, Ariane, and indeed, crossing toes, fingers, and everything you can that we don't have a fourth, fifth, sixth wave, whatever, and that all can go through as planned. So now is the time to put forward some questions. If you have those, you can use the chat for that. So at the bottom, there's a text balloon that says chat. Just start typing whatever questions you have. In the meantime, there's already in the chat some discussion whether the Red Devils will win the European Championship. Time will tell, and we'll know in July. But anyway, the question already came in, when are the workshops planned? Alan asked that, so we already showed you the timings. So the workshops over summer are scheduled during the evening. When you work with your group in between coaching sessions, that's of course a decision you make as a group, whether you work during the day or at night, or you divide the work and you only get together over weekends. It's all taking place virtually. Seeing the circumstances, everything will be online. And the only exception to the evening rule is the fact that the workshop on July 2nd that Kim mentioned, that is taking place during the day. We'll start at 10 a.m. and work through the day so that we have a full day in which we can go from these fuzzy problems into a potential solution. So Alan, I hope that answers your question. If not, then do give a shout in the chat window.
And I'll also add one more thing. We plan to record the workshops. We know that we can't fix a date that works for everybody. So if one person from a team can participate in the workshop, that would be great, one at least. But we're also recording them and forwarding them to you through email if you cannot make it.
Thank you for that add-on, Kim. Couple of other questions, and Luca also mentioned regarding the jury. We're still indeed looking to add a few more experts in intellectual property field and the business field in the startup world as well. And he also adds they will not be Italians. So thank you for that, adding Luca as well. A question from Darren. Could you share some examples of previous products, ideas that have been created? I can go talk about generic hackathons, not necessarily around organ transplant ones.
Yeah, maybe something that we didn't say. This is the first edition of the ESOT Hackathon. So in this particular setting, there are no previous products or ideas that were created in the ESOT Hackathon. But as Tom said, we have plenty of examples from other hackathons that we've organized. Tom?
The thing about hackathons is that if you typically consider hackathons, they're 1 or 2, 3-day events. Everybody gets together writing code, and then everybody goes back home, and it was nice, and you had way too much pizza. But we tend to look at how can we create an afterlife for these hackathons. So we do that in several ways. One is we work on real world challenges instead of just thinking about what could we do. So that's why we asked some experts to bring their perspective, that we really try to solve real issues. And secondly is to work on that viability aspect, and we'll start doing that really early on in the innovation cycle. And in order for some examples, if you're looking for some examples of that, one of the first ones we did, there was a nurse that pitched a challenge around cardiac monitoring. Has nothing to do with organ transplant, but just generic in a hospital, multiple monitors to look at one ICU patient. And she said, well, it should be possible to bring all that together in one dashboard that would simplify our life. We could have more of an overview of a patient instead of looking at all these different monitors and switching screens all the time. So technology should be able to facilitate that. Her name was Linda. That was a nurse. And there was an entrepreneur in the audience who stood up and he said, Linda will take care of it. And the project name was Linda Care. That's where the name comes from. And in the meantime, they're a multinational company and they collaborate with Philips. So it can start at a hackathon, and we have many more examples like that, like Quicksilver and Neuroventus and what have you. They all originated during hackathons. I think this is our 20th innovation / hackathon, something like that. I lost track somewhere along the way, but we've done many before, and we try to really give it an afterlife. And that's why we'll emphasize during July 2nd already, think about viability. And you will get annoyed by hearing that, think about viability. But that's the way we approach things. So Darren, I hope that gives you some ideas. The better, of course, your project idea is, the bigger the chance of an afterlife. If you solve a real issue, chances are that the project is being adopted by real users, of course. There's a question from Danielle. Is it possible to add team members after July 2nd? Kim, maybe a question for you?
Yes, of course. Is it possible to add a team member after 2nd of July? Yes, of course. If one of your team members cannot join throughout the 2nd of July and wants to join afterwards, that is fine. We will, I would say, send me an email so that I know who this person is, and then I could already add them to our invites for the rest of the program. Is it going to cause problems? I don't think so. It's important in your team on the 2nd of July that you have the key angles, the key stakeholders in your team. I think that needs to be kept in mind, but you can always add people afterwards.
But it might be, for instance, that the jury gives feedback during the first pitch on July 2nd. You're missing that perspective. And of course, that's a clear hint at that perspective by the time you come back in October. So,
yeah, absolutely.
Like Danielle says in here, indeed, if the team realizes they need additional expertise. So absolutely. Luca also adds in the chat to also disseminate the hackathon opportunity to your network and to anyone who could be interested in participating. The more souls, the merrier. It's going to be a fun experience as well. It's quite intense on July 2nd, but it's going to be a fun experience. So don't worry about that. And if you have any questions, just drop an email to kim@bhic.care. Her email address is on the slide right now. So Ellen asks, I have no medical background. Can I join? I think the answer is absolutely yes, but I'm not sure if anybody wants to add something on to that.
Yeah, I think it's important. Indeed, it's a good question. Obviously, yes, we do want to have not only medical people from the medical world. So everyone is really welcome to join. And as Kim and Tom already said, we're also there to form teams if there's no team already set up. So yes, you can join, Ellen.
The most successful teams in hackathons are typically multidisciplinary. You sometimes have teams that go to a hackathon, or that the more classical hackathon, the 3 days in a bunker somewhere, that think, oh, we're fully complete. They go in, they think they will win it, and then there's some team of youngsters that are multidisciplinary that looked at it from a completely different angle and take away the main prize. And very annoying for these typical hackers, but so definitely yes. Just checking whether there are still questions coming in, and for the sake of time, no. Going once, going twice. Oh, that's really sharp. 6 sharp. That's the way we scheduled it. So from all of us here at ESOT and at Blue Health Innovation Center, thank you very much. We look absolutely forward to seeing you on July 2nd. We have a full day scheduled where we'll take these challenges and start converting them, and then kickstart the entire process over summer. And hopefully we see you on July 2nd and then October 9th. And then who knows, maybe physically in Athens. That's, of course, the end goal we're all going for. Thank you to all the speakers who were here with us today. Thank you for your insights. Looking forward to continuing the journey with you, and to all the participants. See you on July 2nd. Thank you very, very much.